Originally, the idea of a seatbelt came in the 1800s from an English engineer named George Cayley, who was trying to keep pilots safe inside their relatively primitive gliders. He was literally trying to stop them from falling out of their planes. When cars arrived, almost from the very beginning, people started fabricating their own seatbelts, but mostly to reduce the bouncing. Bouncing which sometimes resulted in bouncing them right out of their cars. In the 1930s, physicians saw firsthand the deaths and injuries people suffered when thrown from their cars. So they equipped their own cars with lap belts and urged auto manufacturers to provide them for all new cars. And today, the primary reason why it is safer to drive is because of seatbelts. Seatbelt use doubles the survival rate in a crash. Seatbelts reduce the number of lives lost each year in a car accident, potentially saving more than 1 million lives since 1959. And in the United States, even though there are infinitely more cars on the road, the car crash fatality rate per capita is almost half of what it was in 1976. With seatbelts, maintaining the status quo became unacceptable and unsustainable. A change had to be made because we faced a price too high for not doing so. Now that rallying call is at RWJBarnabas Health and around the world. You guessed it, it's patient safety. And the hard truth is that preventable harm still happens here. This has motivated us to speak, act, and make decisions differently, even when uncomfortable, because if we don't, the risk is harm to someone's loved one. This is our commitment since 2017. RWJBarnabas Health is committed to safety together and 0 events of preventable harm for our patients, families, visitors, and each other. Grandfather, best friend, wife, brother, secret keeper, comforting hugger, Mrs. always up for late night pizza, road trip companion, partner. Our patients are all somebody's picture person, probably in a loved one's phone or wallet or framed on a wall. That is why we owe them an exceptional experience that is highly reliable. From our patient's perspective, that means 3 things. 1, don't harm me. 2, help me. And 3, be nice to me. Do all 3 of those things every time with every patient. Picture a loved one or friend for a moment, your go-to person. Wouldn't you want that for them? That is the mission of Safety Together. This is Jill's office, and she's one of the leaders championing Safety Together at RWJBH.
Hi, come on in.
I know we still have a long way to go, but can you give us some context in terms of where we are right now?
Sure. Currently, on average, we seriously harm 2 patients in our system every day, and we experience a preventable death once every 1.5 weeks.
And we're not talking about natural deaths or the course of a person's disease or diagnosis, right?
Correct. We're specifically talking about preventable death and harm. This has improved since we started the Safety Together journey, and it will continue to improve until we get to 0. Our reliability and safety cultural work is all about increasing the number of days between events. First, we'll strive for an event-free quarter. Then we'll go 6 months without a serious safety event. With all our efforts, we will eventually have an event-free year.
Is that possible?
Yes, but only if we set it as a goal and work diligently in reducing human error and identifying the system problems that can lead to these preventable events of harm. All of these things can happen with good clinicians who come to work to take great care of their patients. They don't happen because we have bad people in our health system. They can happen to even the best workers who have the best intentions. We've heard the stories. It stops happening when our best workers work together on every level, questioning, intervening, reporting, and fixing the holes in the Swiss cheese. We are all human, and we make mistakes from time to time. But our system should not allow a single error to result in an event of harm. Therefore, we design barriers to help catch the errors and prevent them from resulting in events of harm. This is called defense in depth. The slices of Swiss cheese represent that defense in depth. Good defenses can include technology, like when a pharmacy order entry system warns the pharmacist of potential drug interactions. Or it could be processes or policy. For example, when an operative site verification procedure requires the operating team to pause before making the incision to confirm the correct site. Or even other people, such as when a coworker reminds us to wash our hands or double checks a medication. Sometimes good checks and barriers fail, seen as holes in the Swiss cheese. When all our best defenses fail us, an error that otherwise would have been caught carries through the holes unstopped and results in a safety event.
Wow. Thanks, Jill. Safety events at RWJBH are real people harmed by all types of errors being made. Errors like not washing our hands, not making it safe for team members to speak up, not recognizing when a patient is going into a heart arrhythmia, not intervening when a patient insults a coworker with a racial slur, not listening to a patient's concerns, and much more. Again, these things don't happen because there are bad people at RWJBH. They can happen to even the best workers. And it stops when we all work together to fix the holes in the Swiss cheese. And when that happens, it creates an exceptional experience that is highly reliable. Excuse me, Paula, do you have a minute? Yes, Emily. How can I help you? We received a letter today from one of your former patients and thought you should see it. I want to start off by saying thank you. I went into the operating room scared and alone. This was my third cesarean, and no matter how many times I've done it, it feels like the very first time. Paula knew I was scared when she looked into my eyes. So she held my hand, prayed with me, explained the process, and told me everything will be okay. She calmed me down and gave me faith as I sat there receiving my epidural. If it wasn't for her, I'm not sure if I would have been able to do it before my partner was able to come into the operating room. I'm sure she's touched other mothers the same way she touched me. She's a great addition to the RWJBarnabas family. Thank you, Risha and family. She kept them safe. She did all she could to help and heal them. She was nice to them. All three things, every time, with every patient. There's a great picture of a great person. Safety doesn't happen in a vacuum, though. We need to keep each other safe, too. More on that soon.